Hello, everyone. It's Monday, January the 11th. We got a lot of stuff to go through. We'll get through it as fast as we possibly can. To be perfectly honest, it's hard to imagine me saying we've had 40 additional deaths, and me sitting here saying to you, that's a heck of a lot better than where we've been. And naturally, we don't know if over the weekend we had some delayed reporting and whatever. Let's just hope and pray this is the trend. I read, I think, 78 or 73 and 85 the day before that, and it's been really tough stuff, because a lot of people are out there really, really hurting. But 40 people passed away. We have a total of 1,595 deaths now in West Virginia. Our 1,555th death was a 75-year-old male from Mason County. Our 1,556th death, a 91-year-old male from Upshur County. Our 1,557th death, an 89-year-old female from Cabell County. Our 1,558th death, a 93-year-old female from Ohio County. Our 1,559th death, a 50-year-old male from Berkeley County. Our 1,560th death, a 50-year-old male from Lewis County. Our 1,561st death, a 78-year-old male from Upshur County. Our 1,562nd death, an 86-year-old male from Berkeley County. Our 1,563rd death, an 83-year-old female from Monongahela County. Our 1,564th death, a 67-year-old male from Preston County. Our 1,565th death, a 90-year-old female from Hancock County. Our 1,566th death, a 69-year-old male from Ohio County. Our 1,567th death, a 90-year-old female from Preston County. Our 1,568th death, a 72-year-old male from Marshall County. Our 1,569th death, an 85-year-old male from Ohio County. Our 1,570th death, a 69-year-old female from Kanawha County. Our 1,571st death, a 77-year-old male from Hardy County. Our 1,572nd death, an 89-year-old male from Upshur County. Our 1,573rd death, a 52-year-old male from Logan County. Our 1,574th death is a 74-year-old female from Raleigh County. Our 1,575th death is an 84-year-old male from Kanawha County. Our 1,576th death is an 89-year-old male from Harrison County. Our 1,577th death is a 66-year-old male from Boone County. Our 1,578th death is an 81-year-old female from Marion County. Our 1,579th death is a 70-year-old male from McDowell County. Our 1,580th death is a 77-year-old male from Hampshire County. Our 1,581st death is an 80-year-old male from Upshur County. Our 1,582nd death is a 78-year-old male from Boone County. Our 1,583rd death is a 92-year-old male from Hancock County. Our 1,584th death is an 84-year-old male from Wayne County. Our 1,585th death is an 87-year-old female from Fayette County. Our 1,586th death is an 88-year-old female from Berkeley County. Our 1,587th death is a 78-year-old female from Hancock County. Our 1,588th death is a 75-year-old male from Hancock County. Our 1,589th death is an 81-year-old male from Hancock County. Our 1,590th death is a 100-year-old male from Ohio County. And bless his heart and all these folks. Our 1,591st death is an 85-year-old female from Fayette County. Our 1,592nd death is an 87-year-old male from Lewis County. Our 1,593rd death is a 60-year-old male from Cabell County. And our 1,594th death in West Virginia is a 57-year-old male from Wood County. Oh, me, a lot of names, lots of great people. Lots and lots of great people. Lots of wisdom. We started Operation Save Our Wisdom, did we not? In trying to absolutely vaccinate our elderly. They are our wisdom. Please keep them in your prayers. Please, please do that. Yesterday in the state of West Virginia, we reached 100,000 total COVID cases from the very beginning. 100,000 from the very beginning. We had new positive cases yesterday of 1,070. Our cumulative rate is at 5.38. Our positive rate is at 8.77. We have active cases in the state of West Virginia of 29,257. We have recovered cases in the state of West Virginia of 71,431 people. 755 are hospitalized and 212 are in the ICU units. This weekend, we tested 25,104 West Virginians, and today, our RT number has moved down in West Virginia to 0.96, and we're the third best in the entire nation today. And you know how that bounces around, so let's just don't get a false sense of security. 53 of our counties are in the red and the orange. I remind you over and over and over, if you're 65 years of age and you get the least bit sick, please go get a test. Please, please, please go get a test. And if you'll do that, and we can catch this thing early enough, if you are positive, we'll get you the antibodies, and the antibodies will shut this thing down. At least we think they will. If you mess around with it, and you're 7 to 10 days into it, when you really realize you really got to go get a test at that time, the antibodies really aren't much help. Over and over and over, it's easy as mud to see, that all the names you read, predominantly the overwhelming majority of the names that we read are 70-year-olds plus. This morning I appeared on CNBC's Squawk Box, or Squawk on the Street, and they did a nice thing, I think, in regard to our vaccinations and how we're getting stuff out in West Virginia. I think you'd be really proud to see this, and we're going to show it to you right now.
Obviously, a lot to talk about this morning with West Virginia Governor Jim Justice, the vaccine rollout, the transition, the attack on the Capitol, and more. Governor, it's good to have you back. Good morning.
Thank you guys for having me. I appreciate you.
I want to start with the vaccine because a lot's being written this morning about West Virginia. If I'm not mistaken, all of your first doses have either already been administered or assigned to a name. And a lot of people wonder if that's because of certain decisions you made about opting out of large federal contracts.
Well, if I could just tell you real quick, and this won't take but a second, but West Virginia has been a model all the way through this. I mean, if you just think we were the first in the nation to test all the people in our nursing homes and our assisted living, we've kept the economics of the whole situation in the state going well and everything. We're first now to vaccinate all of our nursing home residents and staff, as well as our assisted living. And as we've gone forward now, we had to make a really big pivot and everything, a pivot away from really going with the Walgreens and the CVS to going with our National Guard and what we know we can get stuff in people's arms. This is all about age and age and age. That's just all there is to it. And so if you can just imagine this little state with some really, really smart people and all the stuff that we're doing today, right as we speak today, we don't have, vaccines in a warehouse sitting on a shelf. We've got them in people's arms. And today we have 100% of the vaccines that we've received that are either in people's arms or have a name tagged to the vaccination that they're going to get, and they're going to get in the next couple of days. And so now what we need in West Virginia, we need more vaccines. And we stand ready to be able to help anybody in the nation and tell them, the little secrets that we have and what we've been able to do to make this all happen here.
Yeah. CDC, I think, has now named West Virginia as the #1 state for administration per 100K population based on today's numbers. That's an achievement. Is it something that is specific to your state, Governor, or is it a model that you think other states might try to at least adjust and adopt?
Well, the whole secret to the whole thing is just this. And I said this to our National Guard, and I said this to our leading medical experts, but I said, you're about to get caught in something here, and you don't really know you're about to get caught. And what you're about to get caught in is just this. We're going to awaken to the fact that we are trying to develop a plan on how to give out the vaccines. And while we're developing a plan, people are dying. People are dying all over the place. And absolutely. So what do we really need to do? I hate to say it like this, but it's just as simple as just this. If I would say how many cows are out there in that field, count the egg-sucking cows. Don't count the legs and divide by 4. Just count the cows. And with all that being said, what we did is we reacted to the fact that we would have vaccines sitting on the shelf. And we reacted to the fact that age was driving this, and these were the people that are dying. And we really aggressively got after it and everything. And these great people in the state of West Virginia are making it happen.
Governor Justice, I love hearing that these vaccination rollouts in your state are going the way they are. And I hope other governors are listening to, I guess, your secrets and how you're making this happen as quickly as you are. I do want to shift gears a little bit, though. You are a Republican governor. You are a supporter and I believe a friend of President Trump. I just want to get your response on the record to some of the goings on we've seen in the past several days, whether it is the riots in the Capitol building or whether it is the president's accounts being suspended indefinitely on many social media companies' platforms.
Well, let me say this first and foremost. I am a friend with the Trump family, and truly, I am more of a person that's respectful to the presidency of this great country. What happened with the attack on our Capitol, with people that are just out of control, is despicable. That's all there is to it. There's no other way around it. I absolutely understand the frustrations of our president and all the 75 million people that supported him and everything. I understand that level of frustration. But absolutely, we have got to step back and take some deep breaths and realize that we're Americans first and foremost. We aren't Democrats and Republicans first and foremost. We're Americans. And for crying out loud, this makes us look terrible beyond belief. Now, from our president's standpoint, I think what we should always do is be respectful of the job that he has done. He has done so many good things, but absolutely, where we're going here, anybody would have to say, we got off the rails, did we not? I mean, that's just all there is to it. We got way beyond the parameters that we should have been. And really, when it really comes right down to it, I hope and pray that what we will do is Americans will step back and be Americans.
Governor Derek Evans is a Republican West Virginia state lawmaker who resigned after he was arrested after filming himself inside the Capitol last Wednesday. Do you think that those who have been arrested and will probably go to jail are going to serve as examples to those who might want to do something like this in the future? Well,
a long time ago, and I've got white hair, so a long time ago, there was a program, Laugh In. And I think at the time they had a dumb bunny. Well, Delegate Evans is a dumb bunny. That's just all there is to it. To run up there and film yourself and go through all that and everything, I mean, that's nothing but a dumb bunny. And so from my standpoint, I don't know Delegate Evans, who's newly elected and everything. But from my standpoint, if you're going to do that stuff, really and truly, you ought to suffer the consequences.
Governor, President-elect Biden plans to lay out an economic agenda on Thursday. There's an expectation that there could be hundreds of billions more in stimulus proposed by him. What are the expectations, I guess, for you in terms of additional funding for your state? Where would you want it? What would you need, if you need?
Well, absolutely. We're not immune to suffering through this pandemic. I mean, it was a cannonball to us like everybody else and everything. In fact, we even had to move the filing date for our income tax into another fiscal year. So it really doubled down for us. Now we got through it, and I am a real believer that you first and foremost got people out there that are really hurting. I mean, if you just think about if you were sitting out there trying to pay your utility bill or car payment and you were unemployed because of this terrible pandemic, or a restaurant owner that absolutely, has just been paralyzed, and on and on and on, there is an absolute mega need for the stimulus. Now, I've got to say this. I pleaded with our president and I pleaded with everybody that we just dinked around forever. And that's all there is to it with the stimulus package that just came out. It should have been out a long time ago. Had too many people out there really hurting, businesses and employees and people that were really suffering. So with all that being said, at the end of the day, our state surely needs dollars as well. But with that, we've got to be smart in how we appropriate certain things. But let me just end by just saying just this. The biggest thing that we can do in moving forward to stimulate our economy is not just jumpstart it with a few bucks a day. We've got to jumpstart our economy with a national infrastructure program. We absolutely can really jumpstart our economy with that. And I hope the Biden people listen to that and everything, and they move forward and everything. And I look forward to working with them because, I'm first and foremost an American. I just want good stuff for our country, and that's the only reason I'm here.
Governor, we love hearing from you. And again, country's watching you and the effectiveness with which you're administering the vaccine. Thanks for the time, as always.
You
Justice
guys always
West
do
Virginia.
great. Thank you.
Okay, everybody. In that, I think we announced probably another milestone in West Virginia that is an incredible feat that has been accomplished by our National Guard, all of our health people and everything, and all the great experts that we've had working with us over and over. But if you just think, where other states are struggling to get out of the blocks, I think, really, if I'm correct, and I just want to make sure of this, so just bear with me, but, well, no, I don't. I know in North Carolina, North Carolina just moved, I think, to possibly bring in the National Guard to be able to help them. I think, from the standpoint of New York has just come up with a novel idea that, hey, we better, turn our emphasis a little bit towards our seniors. I mean, are you give me a break, please? I mean, all of everything has been telling us age, and age. But really, special thanks. I mean, really and truly, we can come up with the ideas, but the people that are on the front lines, that are out there, whether they be all of our health community, all the first responders, all the different people from everywhere that are helping in every way, especially our National Guard, I love you to death, and I thank you for all you're doing for a lot of great people. But West Virginia, understand just how important these things are to our state. As the world sees West Virginia leading, it drives people to us. It makes people want to come to us. It changes our image, and it does a lot of good for us. But to say that while the rest of the nation is just stumbling around in every way and trying to figure out what to do, and absolutely by the number of vaccines that have been pumped out, imagine this, our nation as a whole is struggling. Around 30% of those vaccines are in people's arms. Well, in West Virginia, every last one of them is either in an arm or has a name tagged to it that says this person, John Doe, is going to get this shot either today or tomorrow or the next day, But this week, those shots will all be in somebody's arm. And right now, while the nation's numbers are bouncing in somewhere around 30%, I think in the state of West Virginia, in arms are above 85% right now. We have 93,000 of the vaccines that we have received into this state that are in somebody's arm. Now, in addition to that, we're making phenomenal progress in regard to, in the next couple of weeks, we ought to be ending up all of the people that are in our nursing homes that now have gotten the first vaccination, and they'll have the second vaccination. You know, it is really, it is amazing stuff, and it's good stuff. And the number one thing that it will do more than anything in the world, and nobody can argue this with me, it's saving lives right now, right this minute. Good old West Virginia that knew how to move without a playbook, knew how to move to get something done. You've done really, really good stuff. And I really appreciate all those that are making this happen. You know, there's a couple other articles, you know, just came out about West Virginia and everything, NPR, and believe it or not, a guy in Canada wrote. Now think about this, and right here is the article, but he titles the article, How West Virginia, one of America's poorest and most rural states, became a leader in rolling out the COVID-19 vaccine. Well, I can tell you how. I can tell you, it was easy for me. You know, West Virginia abounds with smart people. And West Virginia abounds with practical thinking, good, hard-working people. That's how. That's how. Nobody expected it. Nobody has expected this all along. But West Virginians, you've done really good. And I couldn't possibly be more prouder of you than I am right now. You know, there's no point in me going through all this stuff, you know, about what's going on with our nation, but I'll jump all the way over here and I want to read this to you. Our COVID-19 vaccine info line, and it's this, the COVID-19 vaccine info line will operate, this is new, will operate Monday through Friday from 8 a.m. to 6 p.m. and Saturdays from 9 to 5. The number is up on your screen, 1-833-734-0965. It will serve as a point of reference for West Virginians seeking information on the COVID-19 vaccines, vaccination timelines, and any other questions about the vaccines. And you know, we've also have a lot of information on our coronavirus website. You know, just a vaccine reminder, take the vaccine. Come on, everybody. I mean, what in the world? What in the world are you afraid of? I mean, really, are you afraid of growing a third arm or whatever, or growing antlers? And I'm only being facetious to make my point. You know, so many people have already been vaccinated all across this land. Where have you heard? Where have you heard of bad things happening? You know, so go get your vaccines, please, when they're available to you. Now, the other thing is just this. You know, I tell you over and over, if we can catch this early enough, the antibodies will do you incredible good. Now, wait, they're telling me I've skipped something, so let me go back here just one second. It says I skipped the vaccine clinics that are on the new dashboard. Now these, hold on just one second. Let me go back. Just bear with me, I'm sorry. Okay. Okay. Let me make sure I got this. I've got all this, but there's going to be 12 regional community vaccination clinics statewide this coming week. And we will announce the details tomorrow when we have all the details, but this is the National Guard putting together those clinics, you know, at the National Guard armories or at the clinics, you know, throughout different parts of the state. But if you just stay tuned to that, and as we continue to get additional shipments in and all those things, we'll just get more and more people that are vaccinated. And this is up on the new dashboard. Is that what you're saying? Okay, well, forgive me, I'm stumbling here, but We have a new dashboard, and it'll be up on that. Okay. In regard to the school executive orders, as we continue to plan to go back to school on January the 19th, I am signing an executive order to officially allow counties to return to an in-person learning. Additional guidance will be published by the State Board of Education later this week. They have a board meeting on Wednesday, and they'll give us additional information after that. Again, I am allowing schools to return to in-person learning for 8th grade and below. Grades 9 through 12 will not be in school in the red, and this will be the same for private and Christian schools also. Now, I want to qualify one thing. Our medical experts are going to advise me on expanding the orange zone. And so we may very well, we'll give you information on that on Wednesday, but we may very well be expanding the orange zone, which will allow us a little bit of additional freedoms and everything in regard to our ability to go to school in orange and not be as restrictive as we have been. To be perfectly honest, at 25 to go red is a very low number as compared to other states throughout our nation. And so I'm going to get additional information from them. We will look, as I've said in the past, at expanding that orange level, but in orange we will go back to school. You know, our medical experts believe with all in them that the exposure for going back to school is extremely minimal. And from the standpoint of our 8th grade on down, it is very, very, very minimal. And so they believe that it is absolutely safe. Now, in regard to sports, we've been in communication with the WVSSAC a whole bunch. We have talked with our our education community. We're going to allow games to begin. If we're in school, we're going to allow games to begin for winter sports on March the 3rd. Practices will begin, if we're in school, on February the 14th. And this gives, you've got now, when you go back, you have to have 14 practices. 14 practices before you can play. This gives us, I think, 16 days that we can practice and get our 14 practices in. Now, you got to understand, too, if you're in the red and not in school, or you're in remote and not in school, we can't play. We cannot play. Okay? You know, I tell you over and over to get tested. All the free testing map and everything is up there. The drive-through pharmacy, thank you for all those great people. The school outbreaks are next to nothing. Of course, we're not in school. There was 111 outbreaks in our long-term care facilities. There's 14 outbreaks in our churches in 9 counties: Harrison, Jackson, Marion, McDowell, Mingo, Monongahela, Nicholas, Summers, and Upshur counties. Look, let me just say this. Be really careful going to church, and be really careful wherever you go, and wear this mask and everything. We're getting close. West Virginia, you're doing really good, and we're getting close. We're getting close to really making some real headway with this terrible killer. You know, just continue to help me in every way. Wear your mask. Be super careful about church. Maybe if you're 65 or older and everything, think about just skipping church and everything, you know, for just a little bit longer. This isn't going to last forever. This isn't our way of life forever. I mean, this will pass, and it is going to pass soon if we can just stay ahead of the curve. If you get the least bit sick and you're 65 or older and everything, go get a test. Just help. Help in every way. And first and foremost, help yourself and help your loved ones and everything, because this is a tragic, tragic way of death too. Can you just imagine? And it's happened to 1,594 West Virginians. Can you imagine being in a hospital or wherever you may be, maybe really having a really difficult time to breathe, really struggling breathing? Your loved ones can't even be with you, and they're not anywhere around. And there you are with maybe a friendly nurse or maybe a friendly doc, but they could very well be complete strangers to you. Absolutely, this is not a kind death. Absolutely, you can help yourselves a bunch. And West Virginia, you're close. You're close. Just stay with me, and we're going to get there. The corrections update real quick. We have 404 inmate cases now, 57 staff cases. We have 290 inmate cases at Tigard Valley and 80 at St. Mary's. I remind you again about wearing your mask and taking the flu shot and giving blood. Giving blood. If you've been blessed with recovery and everything, you can give blood that will save a life and everything. Just think about it. I have issued a proclamation ordering that all United States and West Virginia flags on all state-owned facilities be displayed at half-staff until sunset Wednesday, January the 13th. This is in honor of a life and service of United States Capitol Police officers Brian D. Sicknick and Howard Liebengood. And we are doing this in accordance with President Donald J. Trump's proclamation. Like I said, West Virginia, you're leading the way. You're doing really good in lots of ways. But to these names of the 40 that we read today, to the 1,594 that have already passed, we absolutely know just how tragic this is. Please remember them in your prayers. Your prayers are being heard, West Virginia. But my prayer now to you is just this also. And that is just that if you will just hang in there, and you will wear your mask, and you will get tested, and you will be proactive in that if you have a symptom, treat it like a heart attack or a stroke and go get tested. And absolutely, we are running to you with all the resources that we have available to get you vaccinated. We're absolutely moving proactively to be able to get ourselves back in school, and we're absolutely going overboard in trying in every way we possibly can to vaccinate our teachers, and we are doing it 50 and above first because of our limited number of resources. But as soon as we get that done, we'll double back and we'll get them all. And the same for our service personnel as well. That's all I've got. Just keep it up, West Virginia.
All right, thanks, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and I want to follow up with what the governor said, but also I do want to recognize not only our great teams that are leading the way and folks on the front line, but also thank the governor for his leadership in this way. You know, there's no mistake that he has really been the beacon for us to target the level of productivity and efficiency we've been able to accomplish. And I'd just like to make a couple of comments about how well we're doing. And that is not to self-congratulate anybody in particular, but really to recognize the work that each person in West Virginia has been doing to serve each other and to help our state move forward. We are 9th, as I understand it, per capita in testing. We are first in the number of vaccinations that we've been able to give. By the COVID tracking project, we're the first state to break 5 immunizations per 100 people. As the governor's pointed out, we were the first to put first vaccines in the arms of our most vulnerable, our nursing home population. And remember, 50% of the deaths that we've seen in West Virginia are from the nursing home population, and 77.5% of our deaths are from people over 70 years old. So absolutely, getting vaccines in arms of this population absolutely saves lives. And remember from the CDC, if you're 75 to 85, you have a 220 times risk of dying and an 8 times risk of hospitalization versus people that are 18 to 29 years old. And if you're over 85, you have a 630 times risk of dying and a 13 times risk of hospitalization. So as we're looking to save lives and continue to maintain hospital functioning capacity, we know, as the governor said, age, targeting this group of people is so important. But also what's important is that we're not also forgetting the people in our other priority groups that we've outlined. And so we're doing our vaccination strategy in an overlapping, not sequential way. But because we're worried about this surge coming from the December holidays, and we've seen perhaps the sort of the peak of the surge from the Thanksgiving holidays, but in the next 2 to 4 weeks, we're very concerned that the hospitalizations and the deaths may continue to rise in West Virginia. So every vaccine we get into these folks who are in our most vulnerable categories, the more we are going to save lives, as the governor has asked us to do, instructed us to do. So I wanted to point out some changes, and Jordan, if you could put the new dashboard up. So we want to reflect the data for the citizens of our state to be able to see exactly what we're doing. And I'm going to make a few initial comments. I'm going to invite Secretary Crouch to add his comments in. So we really want to look at how many doses that we have received from Operation Warp Speed. And on the left side of the new dashboard will be the number of first doses received from Operation Warp Speed. And then it will be how many of those doses are allocated to a person in the community. And then it will be how many of those doses have been administered, a shot in an arm. And then we want to look at that percentage. And West Virginia is doing so amazingly well. Over 80% is really quite unbelievable. And to the right side, when we look at the 16,575 here, that is the number of second doses we've received, then the number of second doses that have been allocated, then the number of second doses that have been put in somebody's arm, and then the percent of that. And over 80% is really a benchmark that I don't believe anybody else can meet at this point. And we're so proud because of the great leadership, as the governor said, of our National Guard, retired General Hoyer, retired Colonel Joe Peel, and all of our joint interagency task force members. Really, really important. And then we start looking at the vaccines given by date, and then looking at the vaccines per age group. We look at the cumulative number of vaccines, and then the distribution around men and women. The governor also pointed out that we will look for testing places, and we certainly want to make sure that we are opening up more testing locations for people. All of us have received a second dose, and I have to say I've had no real effects at all of that, other than I'm grateful to that we have the vaccine to be able to vaccinate our vulnerable people and our prioritized people. And we would really hope that people choose, if opportunity presents itself, that you're in that priority group, to please choose to take the vaccine. It is so important as a parameter, again, of protecting yourself and protecting each other. Now, many people are very worried about the issue and fearful about the issue of not being perhaps prioritized yet for vaccination. And the thing that we've reminded you over and over is that we already have the equivalent of a vaccine, and that is a mask. And we know in India, where people can't physically distance very well, that masks are protective like a vaccine if over 90% of people wear it. And in India, it's 95%. And they've been able to drop their rate of spread by 75% by just wearing masks effectively. And so as we look at this time rolling up with the potential for a surge coming, please, please, please wear your mask and please choose to get the vaccine. So I'm going to turn it over to Secretary Crouch here just for a second to make other comments, Secretary, on this new part of the dashboard or other elements that are so important for people in our state. Thank you.
Thank you, Clay. Good afternoon, everyone. This dashboard went up right at the beginning of the press briefing. So those of you who have not had an opportunity to look at the changes, please pull that up and look and see what we've done. We really looked at what we were being asked in terms of information and in terms of social media and what people wanted to see. So we've tried to modify this dashboard to provide information with regard to the vaccine itself, as well as all of the other issues we have on the dashboard. Again, we're very thankful to our folks in MIS and DHHR that have put this together. We have some very talented folks that keep this thing moving and updated at all times. On the first tab, on the overview tab, I'm not sure anyone mentioned, we're really refocusing just slightly on people fully vaccinated. That's where we're going to be here as we move forward in West Virginia and across the country. We're looking at getting people vaccinated as quickly as possible and as many people as possible. We want to vaccinate everyone. We ask people to please be patient. It is a process that takes cooperation. I want to thank the governor and the leadership team he's put together here. The reason West Virginia is successful is that leadership and setting challenges for us that at times we think may be impossible or very difficult, but we've met those challenges that the governor's put before us. We have an unbelievable team that's very cooperative, and I want to thank all of them. So, but again, thank our DHHR folks for the dashboard here. Thank you.
All right, thank you both, Dr. Marsh and Secretary Crouch. We'll now go to Dr. Ayn Amjad, our state health officer.
Good afternoon. I just want to mention that we did surpass 100,000 cases over the weekend of COVID cases in the state. So this is just a reminder for everyone that we still need to, as Clay mentioned, to wear our masks and stay vigilant over the next couple of months. As the vaccine rollout does take place, so we do want to remind everyone to be patient. There is several methods that we are rolling out to have the vaccine available to people as much as possible. So please be patient with us, use our hotline number, and we are trying our best to have the vaccine available as time is allowing us to do so. So please stay safe out there, wear your masks, stay socially distant, and we will try to get this done as quickly as possible for everyone in West Virginia. Thank you.
Thank you, Dr. Amjad. Retired Major General Jim Hoyer, the director of the Joint Interagency Task Force, had a prior engagement today, and he will join us again on Wednesday. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. As you said, Governor, there has not been a playbook for this, but there's been a lot of darned if you do, darned if you don't decisions. In the past 9 months, what has been the toughest decision for you to make?
Oh, Paul, it's always really tough, I guess, when you're deciding, that you've got to, go to school, don't go to school, play sports, don't play sports. Those are tough decisions, but really and truly, the toughest always involves, shutting things down from a standpoint of our livelihoods and how we function as individuals, and knowing just all the different people that are captured in the spin cycle that don't have a job and don't know what to do. Christmas was right upon us, and you've got families that as well as I'm sitting here that whether it be a mother or father that had maybe a job or maybe only one of them had a job, and they're really struggling with is there going to be a stimulus check come? can we buy presents? How are we going to pay the power bill? All those different things, life's been tough for a lot of West Virginians, really, really tough. But Paul, ultimately, while go to school, don't go to school, play ball, don't play ball is tough, really tough about closing, things down and everything that we had to do at one point in time. But really, when it really just boils right down to it, I really believe, and I do, and I don't really care who buys it and who doesn't, but I really believe that the good Lord is absolutely in charge of everything. And I believe without any question, He's telling me the things to do and not do. And just the other day, and I sat with, and I could never in the world be more blessed than I am to have had General Hoyer and Clay Marsh and Secretary Krause and Dr. Amjad. Think about the job that these people are doing and all the other people that are all around them. Just imagine the work that they have put out and the decisions they've made, plus all the people that are around me in my office. But now just be real and just be thinking about this just one second. Just the other day, we were all together, and it just hit me like a ton of bricks. I said, the thing that we're all going to get caught in, and we're going to get caught in it, and we're absolutely we're in it right now. And that is just one thing and one thing alone. Instead of being concerned about all the things we're concerned with, the thing that to be concerned with right at this moment is we're caught because we truly, as bizarre as it may sound, and this is going to be confusing to some, but we truly didn't have anywhere to really start putting shots in arms like crazy. And all of a sudden we thought, well, okay, we're going to absolutely at this point in time make a decision to vaccinate our teachers and our service personnel. And it was a way to go with more shots. And with all that, the really decision that was a golden decision is just this, is all those people that were elderly are sitting at home scared to death because Jim Justice is telling them every day, if they get this, there's a high likelihood they could die. Now, and Jim Justice is telling them to go get the antibodies and get tested and on and on and on. And they're scared to death because absolutely at the same time, we're all telling them, you're not going to get a shot until late spring or early summer. And they're sitting here thinking, gosh, there's 80 that's died today and 70 that's died yesterday. And, a bunch of us aren't going to make it. And when we pivoted right at that moment and we said, we're going to go and we're going to test them. We're going to vaccinate them and we're going to move and we're going to move right now. It was a golden moment. And I'd love to say, well, it was all my idea, but I am telling you right now, you got all those people around me, and you got more than anything, you got the good Lord blessing me with decisions and ideas, and absolutely, without any question, Paul, this road's been really tough, and there's been a lot of sleepless nights and really hard decisions, but we've made some good ones, and West Virginia's doing good. But we still got to know that we've still lost 1,594 people, and we're a long ways from being out of this.
All right, thank you, Paul. Next to Kenny Bass with WCHS and Fox 11. Kenny, you may be muted. We can't hear you. All right, let's try that one more time. Sorry about that.
Hello.
We got you now.
Hello. Thank you. I have a question. Thank you for taking the question. I have one for Dr. Marsh. Dr. Marsh, given the fact that WVU is playing basketball, Marshall is playing basketball, of course, with the exception if they have a specific COVID positive test, that colleges throughout West Virginia are playing sports, that Ohio and Kentucky are all engaged in high school sports. Can you give me the medical reasoning to keep players, athletes, and coaches from practicing and playing right now as opposed to waiting until the middle of February and the beginning of March for winter sports to start. Given the fact that there would be no, under the supposition, of course, there are no fans in the stands. So medically, what concerns do you have, and what have you communicated to the governor? Thank you.
Clay, before you go, I'll tell you, Kenny, they're not in school. That's all there is to it. School should be absolutely way, way more important in our sports. But Dr. Marsh, go ahead. You can do this.
Thank you, Kenny. Thank you, Governor. So Kenny, we know that as students become adult size and have gone through puberty, their risk of spreading COVID-19 becomes like an adult. We've talked a lot about younger students, 15 and under, and particularly pre-pubertal students tend to have a much lower risk of catching COVID-19 and spreading it. One of the ideas that's been circulated for the lack of the ability to spread COVID-19 is that their airways are smaller and not as powerful when they cough, so they don't generate the droplets and aerosols like adult-sized people do. We know from our own epidemiology studies that we have certainly seen outbreaks and transmission between people on sports teams, particularly high school level sports teams, and have seen very little spread, as the governor has said repeatedly, and so have I and others, in the classroom. And when you can wear masks all the time and stay somewhat distanced, but as we said, the data from India would really say that masks are really the important single parameter, then we don't see transmission. And so I think in addition to what the governor said, that we certainly want to prioritize school. We believe that's very important for all of our students and that we can get in the classroom. And certainly I know many teachers want to make sure it's safe and with the mask and certainly as we are moving toward vaccination of those teachers in our prioritized category, then we hope that the teachers do feel safer there. But ultimately, the sports teams are areas of not only outbreak, but also transmission. And so I think that at this point, the medical data would say that older students, adult-sized students, and particularly adult-sized students on sports teams are a risk to spread COVID-19.
Me just 1 second too. And Kenny, you know, first and foremost, I love you like a brother, but I want to tell you this too, that the one thing Dr. Marsh wouldn't know, I have had multiple recommendations from our education community, our board of education, our state superintendent, you know, county superintendents have come to me and said, Governor, with what we are going through with volleyball, what we were going through with volleyball and football and people traveling around our state, it just got worse and worse and worse and worse. Can you please do something about these winter sports, because it's going to make it even more and more difficult for us to go to school. So there's a lot of people that are out there, you know, weighing in on these decisions and as we go forward.
All right, thank you, Kenny. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet members. Governor, you talked about the reopening of schools on March 19th and that the medical professionals concur with you. I would like to hear from both Dr. Amjad and Dr. Marsh. Medically speaking, scientifically speaking, what tells you, what informs you to make that recommendation to the governor that schools are safe to reopen that day from a medical and scientific standpoint?
Okay, before Dr. Amjad, I want to correct this. You know, Mark, I think you said school's going to be reopening on March the 19th. That's January the 19th. I know that was just a, oversight and everything, or just a mistake, but nevertheless, Dr. Amjad, go please. But we are opening on January 19th.
Sure, Governor. Mark, January 19th was actually picked by the Department of Education as the start date, and that date was also discussed with us and the governor as a date to pick. But Department of Education selected that date. I believe they spoke to their county superintendents as a date. And we also, starting with the vaccination rollout, suggested that date as well. But the Department of Education selected that date with their county superintendents after several meetings. But we also started vaccination last week with several counties. That gives them at least a 10, 14-day window for the first vaccinations to take effect as well. Thank you.
All right, thank you, Mark. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Remaining with the coronavirus, but more broadly about current events, it's a week from Inauguration Day in West Virginia. Given the continued need for social distancing, are there any changes for how that will take place? And with what happened last week at the U.S. Capitol, along with continued unrest, are there heightened security precautions at the state capitol over the next week or so? The FBI just today reported a bulletin that armed protests are being planned in all 50 capitals from January 16th to January 20th. Thank you.
Well, Brad, I don't really know all the details and everything. I guess we'll get them out, on I'll be sworn in again, on I guess Sunday night, midnight, Monday, January the 19th or 18th rather, and then we're plan to have our inauguration ceremony outside on the following Friday. People are working on it now, how we can keep all the social distancing, and we can do all that from the standpoint of and do it properly. From the standpoint of security risk or whatever. We all need to always be aware, to be vigilant, in the way we handle and go through our lives now. I hope and pray that West Virginians, have good judgment in what they do. Let's go back to this. There was a time not long ago when cities were burning down and there was all kinds of violent type protests that were going on. Not protests, they were violent type protests. But what did we do in West Virginia? We did good stuff, didn't we? Didn't our people do good then? And they'll do good now. We got to watch and we got to be on guard. And I'm sure there'll be heightened alert and all that, but our people are good.
All right, thank you, Brad. Next, we'll go to Matthew Young with the West Virginia Daily News.
Good afternoon, Matthew Young with the West Virginia Daily News. My question is for Dr. Amjad, and I believe this has been covered before, so I apologize for repeating the question. But with regard to the vaccine, if someone receives the first dose, but then unfortunately they test positive for the virus before receiving the second dose, what is the protocol in that situation? I assume they would need to wait until they ultimately test negative and the virus runs its course. But when they do test negative, would they pick up where they left off in receiving the second dose, or would they have to start from the beginning again and receive both injections? Thank you.
Dr. Amjad, that's you.
Matthew, no, you would just take the second dose. You do not pick up from the second dose, what you're saying. So you would just wait till you're not infectious anymore from COVID-19. So if someone receives the first dose of the COVID-19 vaccine and they unfortunately have COVID in between that series, you would wait till you're not infectious so that the person that has to vaccinate you obviously does not become infected with COVID-19, but you will simply pick up from the next series and get your second dose. You do not have to go ahead and get another first dose again, if that answers your question.
All right, thank you, Matthew. Next to Emily Allen with West Virginia Public Broadcasting.
Hi there. Just first off, thank you for the vaccine info on the dashboard. That's really helpful. I have two questions on the dashboard. First, I'm just wondering, is the state going to include racial information, kind of like it did for testing with the vaccine? I see age and sex, but I don't see that. And then secondly, I know hospitalizations aren't record high right now, but our number of people in ICU units or ICU or on vents, they've been kind of consistently around the same area or the same level for the last so many weeks. So can we just get a reminder on how we are with capacity there and what hospitals are doing or being asked to do to make sure we keep that space there and that availability? Thank you.
Secretary Kraus, maybe you could take the first part. Maybe Clay, you can take the second part.
Yes, Governor, thank you. We are looking at additional information to put on the dashboard, Emily. That's a good question. We struggle a little bit trying to get good information throughout the state, and that's just a problem when you have a lot of data coming in. But we do want to provide more information along the lines of race and other areas. So just stay tuned on that. It's a good question. Thank you, and it's an important question. So we'll be looking at that going forward. Thank you. Clay?
Yeah, thank you. Emily, could you just repeat the second part of the question? Was it about hospital capacity?
Yeah, but it was more so about ICU and vent space. I know hospitalizations were not as bad right now, but those seem to be pretty consistently high.
Sure. Well, we know that certainly as we are anticipating, again, a surge from the December and New Year's holidays, then we are very, very carefully watching with our hospital leadership and our hospital association leadership. And so we have the data every day about ICU capacity, ventilator capacity, and also, we have talked about surge planning. We know that making more beds is certainly something that hospitals can do using post-acute care units that are usually used post-operatively. But we also are cognizant that having enough people, qualified staff to work there is important. I think it's also important for people to know, though, that the treatment of people with COVID-19 has changed quite a bit from the time that we first started treating. And we are now really trying to keep from putting people on mechanical ventilators and using other interventions much more commonly and aggressively, like very high flow oxygen or a face mask, special kind of face mask called BiPAP, which is positive airway pressure that varies between the inspiration and expiration. And those two interventions have really reduced the call for mechanical ventilators, but we still feel that we have sufficient supplies of beds and staff and ventilators and other things that we need right now, but we're watching very, very carefully.
All right, thank you, Emily. Next to Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams of Ogden Newspapers. With the RT number back in the green for the moment, I know that fluctuates, and with second dose of the 2 COVID-19 vaccines getting put in the arms and hospitalizations taking at least a little bit of a dip, are we through the possible holiday surge from Christmas and New Year's? And are we seeing the beginnings of the vaccines affecting our COVID-19 numbers, or is it too soon to tell? Thank you.
Dr. Marsh, you got to do this one, please, sir. Thank you, Stephen.
Thanks, Stephen. I think that we have not yet seen the real impact of the December holiday, New Year's, what we perceive to be a transmission of set of events in different states. And we know that places like Los Angeles and Arizona and Rhode Island and several other states are really starting to see a real push on the capacity they have in their hospitals and their ICUs, as was asked previously. We have seen a bit of a cresting that we are perceiving is really related to the surge that we saw from the Thanksgiving holiday. So we are quite aware of the concern because for the December New Year's holiday, because it takes about 2 to 4 weeks after these events to really see the maximal impact. The incoming director of the Centers for Disease Control, who has led infectious disease at Massachusetts General Hospital, one of the Harvard hospitals, has stated that she believes that January 21st will be the worst day of the pandemic because that's about 3 weeks away from the end of that transmission event, which was the New Year's holiday. And we saw more people travel by TSA, and we saw more cell phone mobility during that time. So we're very worried about that. That's why it's so important for each West Virginian to choose to get the vaccine when it's their turn, but also please wear your mask and be really, really careful as the governor is instructed, particularly during this next month or so.
All right, thank you, Stephen. Next to David Beard with the Dominion Post.
Hi, I think my question is probably supply dependent, but do you have any sense at the moment when you'll start wrapping 70-year-olds into the Operation SOW? And as you bring in their various younger groups, 70, 60, will that be announced here on the briefings, and will that information be available on the vaccine hotline? Thanks.
David, we'll announce it, and we'll do it on the briefing and everything, and it'll be also available on the hotline and in every way, and as quickly as we possibly can. You know, the great news is, you know, we're the only state screaming for additional vaccines right now, and you know, and if we keep yelling loud enough and performing the way we're performing, maybe we'll get some more. And so the faster we can get them, the faster we'll get them out there. And I'll promise you that we'll give you all the notice and everything, and we'll be moving to the 70s, 60s, and right on down, and until we get every stone turned.
All right, thank you, David. Next to Kimberly Keggy with WSAZ.
Hey everyone, good afternoon. Governor Justice, this is a question for you. You had mentioned the executive order regarding the return to in-person learning for school districts. So I wanted to follow up and ask you, will this remove the local control as it for say per county for them to decide whether they can return to in-person learning? And what will that in-person learning look like? Will it be a 5-day schedule or a hybrid model? Thank you.
Okay, well, here's what I know. Okay, as far as going back to school and everything, I think that's a call from the Department of Ed, and everything. From my standpoint, you know, we want the locals to have, input and decision making in their process. As far as going back to or going to a situation to where if parents choose to not bring their kids or don't want their kids to come to school, and will they have a remote learning component and everything? Absolutely. From the standpoint of schools just deciding that we're not going to open the school and we're going to stay out of school and be 100% remote, I don't think that that's going to be a possibility. However, you know, that will be a decision of the Department of Ed, and that's not my call on that. You know, so I hope that answered all your questions.
All right, thanks, Kimberly. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if there are going to be any opportunities or any plans to offer any opportunities to our nursing home folks, the staff members who may have passed up getting the shot when it was first given to them. I know those numbers were, lower than we expected. Are there any plans to double back and get that number up where we need it? Thank you.
Well, I think we're already doing that, Charles, and you're exactly right. You know, what happened was, we naturally, people were fearful and everything, and so therefore the percentage of people that wanted to take the shot was, 80 or 85% in the nursing homes. It was pretty daggum high. But now, we've had as many as, I think, about 1,500 maybe statewide. I don't know that that's exactly right, but I think I'm close. People saying now, oh, no, I want to take it now and everything. And absolutely, we're going to get right back through and we'll get them their shots and everything and get them vaccinated.
All right, thanks, Charles. Next, we'll go to WVVA in Bluefield. Not sure who we have on, but go ahead.
Hi, Hannah Howard here with WVVA. We have here in Mercer County, 2 of our long-term care facilities are seeing rather severe COVID outbreaks with a handful of deaths. Just kind of what is the state able to provide any assistance, or maybe aside from the vaccine, or any suggestions for those facilities when they're seeing outbreaks in deaths like that? Thank you.
I'm sorry, I could not understand anything there, but I think, if the question were, I've been told maybe the question was about outbreaks in Mercer County nursing homes, but Dr. Amjad, maybe that was one of the first things you did was run to the fire in Mercer County. So, when you took the job, but nevertheless, Dr. Amjad, maybe you can answer it.
Sure. I'm aware of one particular one in Mercer County that I've been talking to the director of nursing down there. And we basically speak with them daily, or if not every other day, and also offer them assistance with infection control policies and other strike team recommendations. And they also, I know the one in Mercer County, have completed 2 rounds of their vaccines already down there, but we continue to engage with them, offer any assistance that they may need. If we have to, we visit them as well. But as any of the outbreaks, a lot of them involve community spread, but we still do the twice a week testing of the staff as well. But a lot of it is community spread. But other than those engagements that we offer, we continue to monitor them. They are using the monoclonal antibody treatments, I know, of the one in Mercer County, Mercer Continuous Care. So we speak with them daily. We offer them assistance. We hope to see those numbers decrease as the days go by with all the efforts that we've been having throughout the state. But if there's anything specific, you're welcome to email me if there's specific questions about the ones in Mercer County. Thanks.
All right, thank you, Hannah. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. We've been told that legislators are receiving the COVID-19 vaccine. And when I made inquiries of legislative leadership regarding this, I was told this is a directive of the governor's office and to refer my inquiries in that direction. So what can you tell me about the program for vaccinating legislators, and where do they fall on the priority list?
Phil, it's not been a directive, from the governor's office, but and we don't have General Hoyer on here, but it is just offered as part of the plan of continuity, of government and everything. We've got to have our legislatures and everything, to continue to move forward in all the different things we're doing, and we have to maintain our government services. If we don't, we're going to get in bad shape. So we got to have our legislatures, and that's all there's to it.
All right, thanks, Phil. Governor, I'll turn it back to you.
Well, we covered a lot of stuff, and I appreciate everyone. I really got to go back and just say this, just how much. I watched Dr. Amjad, and I just think, what an incredible hire that was, and I see the dedication and commitment to Clay Marsh and all the greatness that he's done, and Secretary Krause just keeps, just head down and keeps on going and everything, and you think about General Hoyer, and he wasn't with us today, but all the people at the Guard and all the great stuff they've done, and then it falls back on all the absolute terrific work of all the, the health departments and everybody across the state. It's not been anything but anything perfect. It'll never be that. But just like today, at one time, I think we showing the dashboard at 92,070, 92,070 as far as people that had received shots. And before we came on here, my chief of staff showed me that the National Guard just notified him and everything. We were above 93,000. And so just in a matter of a very, very short period of time, we almost went up another 1,000 as far as people that had it in their arms. And so it's a lot of good work by a lot of people, and we just got to keep it up. We just got to all run through the finish line together. There's no point in hacking up and beating on each other. That drives me crazy. But nevertheless, the only other thing I'd say is just this, and I know that it's with anything and everything. With this stuff, there's no playbook, and there's no perfect answer. But the reality is really simple. Our kids are becoming devastated by not being in school, and we all know it. We know it just as well as we know our name. And we know the science around every single one of us believes with all in us that 8th graders down, we can be in school today. But to be even more sure, we're taking extra precaution as far as vaccinating our teachers, our service personnel, or doing whatever cleaning or whatever that we need to do. But with all in us, we don't have the perfect answer, do we? But we know this. We know there's kids that are being abused and neglected. There's kids that are failing classes over and over and over because this remote stuff just doesn't work, especially if you don't have a mom or dad that are right with you that are trying to help you. We do know we've gotten in $300 million additional dollars to try to do stuff within our schools and everything to make them safer and better. We absolutely know all the needs of our special needs kids, don't we? Now, we're all trying to make the very safest and best decisions that we can possibly make. And so, with all in us, we need to be back in school. And we need to be continuing to lead the nation like this great state has done over and over and over. We need to get through this, and we will. West Virginians, just hang tough. Wear your mask. Take your vaccines. Absolutely know the warning signs. And if you have some kind of something that shows that you should go get a test right then, please. Give us a chance to get to antibodies. But with all in me, I absolutely mean this when I tell you I love you. And every last one that has helped me with all these decisions and everything, I thank them. And because they have been superstars, to say the least. Nevertheless, that's all I've got. God bless each and every one of you.